afternoon, everyone. The topic for my presentation today is to quantify and compare treatment effects of Gua-Sha and ischemic compression technique, which is a common physical intervention on female upper trapezius active myofascial trigger point with sonoelastographic measurements. I'm Hui-Chun Huang, and I'm a physical therapist from National Taiwan University. Myofascial pain syndrome is an important clinical symptom. Almost 85 to 93% of people with chronic pain disorder have myofascial pain syndrome. And it could be defined as a non-articular disorder of the musculoskeletal system. And we can always find the trigger point located in the taut band. So in this picture, this is the muscle, and the dark red color is the taut band. And the trigger point is the hypersensitive nodule within the taut band. And it can be categorized into active myofascial trigger point and the latent myofascial trigger point according to their clinical symptom. And the clinical characteristic include local pain or referred pain around the trigger point, range of motion limitation, and local twitch response after applying the external stimulation. According to Simons and Travell's research, the hypothesis for trigger point formation is that when you do a submaximal exertion, like maintaining abnormal posture, the Cinderella fibers, which means the type 1 muscle fiber, will be recruited first, and the motor end plate will release SEH to initiate the muscle contraction. However, after a long period of time, the motor end plate may be dysfunction and release excessive SEH to cause the cosine homeostasis disturbance and lead to sustained sarcomere contracture. It will cause the increased local metabolic demand, and due to the sustained sarcomere contracture, it will compress the vessel and decrease the circulation, and it will lead to insufficient ATP to return the calcium back to the SR. So in this 2D sonograph, we can see that trigger point show as a hypoechoic nodule within the muscle fiber, and in the trigger point, there is an area of local ischemia, hypoxia, and filled with inflammatory mediators. With the technology improvement, sonoelastographic measurement is an ultrasound technique that combines low amplitude, low frequency shear wave, and with real-time Doppler to show the resulting pattern of the internal organs. And myofascial pain syndrome has also used this technique to detect the trigger points area. They use the external vibrator like this to create shear wave and shows that trigger point area like this in 2D sonograph, and they can use the image J to measure the trigger point area, and they found that active trigger point area is significantly larger than latent trigger point and in the normal individuals. However, with this technology, but there is no one use this method to evaluate the treatment effects nowadays. For myofascial trigger point, the current intervention include pharmaceuticals, invasive treatments, and non-invasive treatments such as thermal therapy and also the ischemic compression technique. However, due to the diversity of the method and the controversial treatment outcomes, there is no ideal intervention for trigger point nowadays. On the other hand, we can see that Gua-Sha has been used to treat regional pain and functional problems in Asia and Asia immigrants. And with Gua-Sha, we usually use an oil base like this medium to lubricate the body, and then use the device that has smooth edge to perform a repeated unidirectional pressure stroking over the lubricated area of the body surface. And we can see SAR appear like this gradually, and the SAR will fade out gradually from 2 to 5 days, depends on one's metabolic rate. But there's no one use Gua-Sha to treat trigger point. So in this study, I want to investigate the effects of Gua-Sha on female upper trapezius active trigger point immediately and shortly after Gua-Sha, and then to compare the difference in treatment outcomes between ischemic compression and Gua-Sha. 20 to 60 years old female who with neck and shoulder pain over the past 3 months were recruited due to the higher prevalence in female of myofascial pain syndrome. And they need to have active myofascial trigger point in one or both upper trapezius, and palpation will cause localized or refer pain more than 4 out of 10 on VAS severity. And their subcutaneous thickness must less than 1 centimeter due to the external vibration limitation. And the exclusion criteria include anticoagulants, hemophilia, which is the contraindication of Gua-sha intervention, and those who have spinal surgery within last year, radicular symptom, disc problem, a serious illness like DM or cancer, or those who undergoing any treatments or studies will be excluded. The study design was a single-blinded design, and the assessor was blinded to the subjects group. At baseline, we will perform a general physical examination to measure the baseline data, and then they will be divided into Gua-sha group and ischemic compression group with stratified randomization based on their VAS severity. And after intervention, the outcome measure will be taken immediate, 2 days after and 7 days after as a follow-up measurements. The TerraZone T3000 ultrasound system with 12 to 5 MHz with a resolution 0.5 millimeters will be used in the study. And the Philips Sonic Care, like this, the electric toothbrush was used as an external vibrator to create the shear wave. And this is what we take measures during our experiments. For the intervention, we only take the intervention on the most painful side or the randomization side if the bilateral upper trapezius have the same severity, and we only focus on the local active myofascial trigger point with the same duration under 5 minutes. And both groups will give general advice to maintain proper posture and avoid any undue stress to the neck. And this is how we do. During Gua-sha, we use the oil bath to lubricate and then use repeated unidirectional pressure stroking. And you can see that sha is gradually appear, the red. Sorry for the video problem. Okay, like this. Okay, and another one is the ischemic compression technique in the supine position, and the therapist will use the hand to grasp the trigger point until tissue relax or after 90 seconds like this. Okay. And the outcome measure includes the cross-sectional area through sonoelastographic measurement, passive side bending range of motion, neck disability index, pressure pain threshold, VAS, and the pain intensity when applied 20 Newton compression force. In order to reduce the repositioning error of the transducer, all subjects were in the stand-up position with full button seated and backrest and unsupported. And we will use an athletic tape like this to create the custom-made model to record the transducer position. And we also use the inclinometer to record the sagittal and frontal plane position of the transducer. And we also test our test reliability, and the reliability shows good. All statistical analysis was performed through SPSS version 17, and a significant level was set at p less than 0.05, and at baseline data, two-tail independent t-test was used. And in the outcome data, intention to treat analysis and two-way mix ANOVA was performed to measure the two groups by 4 times effects. At baseline data, we can see that there's no difference between two groups in their age, occupational, time for computer for 3C products on workday or weekends, heavy work duration of symptom, VAS, subcutaneous thickness, and their involved site. And this is what we had for the sonoelastography measurements. And we can see that trigger point area as hypoechoic here, and we will take 3 screenshots to measure the trigger point area through imaging system also. In Gua-sha group, we can see the fresh petechia immediately after intervention like this, and it will gradually fade out like this after 2 days. And in the ischemic compression group, we can only see a light redness like this at immediately, but there's no obvious change over the skin as the whole program. The result shows that Gua-sha group has significantly reduced the cross-sectional area of the active trigger point at immediately and sustained for 7 days. But in the ischemic compression group, there is only reduction at immediately. Gua-sha group also shows improvement in passive range of motion, and ischemic compression group shows a significant reduce in pressure pain threshold, which means that laser force would induce their symptom. And in the pain intensity when applied 20 newtons, ischemic compression group also shows the more severity symptom at 7 days, but both groups shows the better improvement in NDI and at 2 days and VAS at 2 days and 7 days. Based on the result, we can find that both interventions were beneficial to myofascial pain syndrome by improving their quality of life and reducing pain intensity according to NDI and VAS. And Gua-sha group shows beneficial short-term effects in more measurement outcomes as cross-sectional area and passive range of motion and ischemic compression group, but there was no difference between two groups in all measurements at each time. From the previous study, they also find that Gua-sha showed beneficial short-term effects on pain, pressure sensitivity, and functional status. And there are some possible mechanisms that make Gua-sha effective. First, in 2007, Nielsen utilized the laser Doppler to measure the microcirculation, and she found that there is a 4-fold increase in microcirculation after Gua-sha applied, and it may break down the vicious cycle of the trigger points formation. Second, based on the gate control theory, when we apply a therapeutic stimulation like pressure stroking, and the skin's mechanoreceptor and nociceptor would inhibit pain signal conduct in the spinal cord. And there's also, in 2009, Dr. Guang utilized Gua-sha applied on the mouse model, and he found that there's an upregulation HO1 in mouse model. And this is, and HO1 has cytopractic and anti-nociceptive effects. And it also is the material that form anti-inflammatory and immunoregulatory properties. On the other hand, in ischemic compression group, previous study also showed its benefit to reduce pain, improve quality of life, and functional status. And there are also some possible mechanisms to make ischemic compression group effective. First, after the compression, it will induce a reactive hyperemia, and the compression force can equalize the length of sarcomere in the trigger points. And also, based on the gate control theory, the compression force may cause the therapeutic stimulation and reduce the pain signal conduction in the spinal cord. So from the previous, the trigger point formation and the possible mechanism for treatments, we can find that circulation may also play an important role in the treatment of the trigger point. But we didn't measure the circulation directly, but we measure the subcutaneous thickness and the body temperature over the skin. And the result shows that Gua-sha group has significant increased subcutaneous thickness at 2 days. And we all know that subcutaneous thickness, there has abundance of vessels that reach of circulation. And in the temperature, we can find that both groups have significant higher temperature at immediately. And also in the Gua-sha group, there is higher temperature than the ischemic compression group. So it may indicate that Gua-sha group has more circulation than ischemic compression group, and it can lead to beneficial short-term effects in more outcome measurements than in the ischemic compression group. There are some limitations in the study. First, we didn't have the placebo groups to rule out the placebo effects, and we are unable to measure the subcutaneous circulation directly. Third, also, we asked the patients to keep their daily diary to record their under-stress activity, but we cannot control the inter-subject upper trapezius loading during daily activities. In conclusions, sonoelastography is capable for quantifying objective myofascial trigger point cross-sectional area and identify trigger effects for myofascial pain syndrome. And Gua-sha showed beneficial short-term effects in more outcome measures than ischemic compressions. And this is my reference. Thank you for your attention.
My simple question is that why you chose the female patients only?
Pardon?
Why you chose the female patients only?
Oh, because it is the higher prevalence in the cervical myofascial pain. You can see the prevalence is almost 90%. And why I choose upper trapezius is also there is more than half they occur at the upper trapezius.
In Japan, both men and women feel this pain.
For this,
Also different.
sorry.
In Japan,
Japan?
there's no difference between male.
Oh, really?
Yes.
Also, it may be there has a cultural difference.
Really?
But in Taiwan, I know that there's more in females. Yeah.
Okay, nice.
I think that on the contraindications, you said the lumbarelnia and perhaps all the syndromes that some hemangioma you must consider to be a contraindication. The hemangioma, I don't
You
see
say the
that.
contraindication?
Many syndromes show an hemangioma that perhaps you can't see in the skin,
Okay.
and you can have a brain hemangioma in other places, so you must consider that.
You can use the acupuncture point.
Acupuncture. Pressure. Use the acupuncture.
Acupressure in acupuncture. In point. Acupressure or point.
Yeah, acupuncture is also can be used, but in Taiwan it's not illegal. It's not legal for therapists to use the invasive treatment. So I take the non-invasive treatment for the patients.
Also mean if we use acupressure.
Acupuncture?
No, acupressure.
Acupuncture.
Acupressure.
Acupuncture. Oh.
Can treat or can instead of needles.
Uh-huh.
Thumb,
Yeah. Also, it's like the ischemic compression.
21. GZ21.
Because in ischemic compression, it's also used the grabs. So maybe it's the similar intervention. Yeah, but has different terms maybe.